something, but I'm going to tell you some tricky ways of doing that. Next slide, please. So first of all, this is the new dashboard, which is actually quite straightforward and updates as you put everything into your records. So you can have a little look at that page. It's a little bit small. So if you go back, just at the top of it, it's actually quite nice because it shows you how much CPD you've done, and it sort of calculates everything and adds it up, gives you the little wheels showing the sections that you've completed, how much you've got to complete, and then your separate sections, obviously you get a tick once you've fulfilled each section. And that'll be what the new page looks like when you open the website. Next slide. You'll get some little graphs like this and lists of what your requirements are and how much you've achieved to date over an annual and a 3-year period. The idea is that you're to try and do things that will fit in with all the different categories that we use at the college, all the competencies. And those competencies have been added onto in the last year. We've added cultural competence and cultural safety. And again, I'll tell you some little easy ways to complete those. Next slide. Okay, we've got it. So what is area of practice and how does it relate to my CPD? So you might have an operative or a non-operative practice, and you need to think about your practice, and then you need to tick off those areas. This box will come up on your CPD platform when you log in, and you can tick off the areas that you are doing. Now, if you're just assisting and you're not actually the major operator anymore, that's fine. You can still tick those areas because you can use those areas in your assisting role to complete your CPD. And then your non-operative areas, if you look at those, there are definitely areas there, medico-legal, for example. Quite a few of you just doing medico-legal work now. I don't mean just, I mean doing medico-legal work now. You might be doing advocacy work, leadership work, teaching, and so on. So those areas are, you just tick the box. Next slide. So back to the I'm a retired surgeon but maintain my medical registration. Why do I need to complete an area of practice? It's actually a requirement of the medical board that you have an area of practice. So you need to tick the area of practice. So the first thing that we're going to have a talk about is the learning plan. And I know this has created quite a bit of concern amongst our fellows. What's a learning plan? What do I need to do? It sounds really onerous. I can tell you now it's not onerous. It's just a tool. Oh, can you go back a minute?
Yeah,
please,
sure.
So it's just a tool to help guide you through doing some self-education throughout the year and gives you quite a lot of CPD points. It can be specific and appropriate and measure goals that align with your area of practice. So I'll give you a great example of the learning plan. And I just finished mine the other day for the first 6 months of this year. At the moment, I'm doing the AICD course, the Australian Institute of Company Directors, because of my roles on council and at the college. And so that's leadership and advocacy and governance. And those areas are actually some of the things that we need to do for our professional competencies. So I just wrote out a nice little 1 or 2 paragraphs in the learning plan section of the CPD about why I was doing that course. It's a lot of hours of study. It's a full week of face-to-face teaching, and then there's exams and so on. But I wrote out a couple of paragraphs about why I was doing the course, how it would help me in some of my roles, chairing meetings, governance, looking at the way we do things at the college, thinking about risk. And then as I was writing it out, I realized that I can actually talk a little bit about my practice, looking at, a bit about the finances of the practice and risk management in the practice. And then I even thought about risk management of patients, things that we obviously do day to day as surgeons, but that I probably hadn't thought about and put down on paper before. So that was a very easy way to get my learning plan ticked off. And there's lots of things people could do for a learning plan. For example, those people doing medico-legal work will often go and do a refresher with the AMA on their medico-legal reporting, and that would be something you could easily write up a little short summary about what you were doing if you were doing a refresher course, or you're going to a meeting where you're going to be talking about, you know, percentage losses or something like that, and you could write a little paragraph about what you're going to do, go off to the meeting, come back, write a reflection, and it's done. So it's really not as onerous as it sounds. Next slide. So there is a template for your learning plan, as you can see there on that slide. So review your area of practice. So again, you can go into the non-operative section, report writing, management health promotion, lots of things that you could choose. And then the competencies, you just need to tick up a competency that would fit. So for example, if you were doing report writing, then you could tick off medical expertise, you could tick off judgment and decision making, you could tick off professionalism, for example. Next slide, please. And then the goals. So for example, if you were doing a course on the medico-legal work, you could say to improve my understanding of percentage losses with regards to, you know, medico-legal reports, you know, improve my report writing style, for example. There would be several things that you could say would be your goals, and then in your review, how you've achieved that, anything that you noticed when you started doing reports after you'd done the course, that, you know, you noticed that your reports are, you know, more concise, or that you feel more comfortable writing them, or that you have more confidence, etc. So those sorts of simple things. It's really not meant to be onerous. Next slide. Okay. How much content do I need to put into a learning plan? I mean, really not a lot. You need to have some nice key points, and it's up to you. You know, a couple of paragraphs, one paragraph, a few really poignant sentences is plenty, and then the review. So it's about reflecting on what you've done over the year, or any activity that you might have done, is all that you need to say. So again, it's up to you. It's not an onerous task. It's just you having a think about what you've done and some take-home points of something that you've learned throughout the year. When does it need to be completed? Obviously just before the end of that year, and if you do it along the way, a couple of months out before CPD is finished, that's fine. Next slide, sorry. So what if I want to do my CPD through AOA or NZOA? That's absolutely fine. You just need to tick that that you're doing an approved program, and there's only three. There's the AOA, New Zealand OA, and the College of Ophthalmology. So they're the three programs. You go into the CPD, see that box, change approved program, click that, and then you just have to put into the box which program you're doing, and the college recognises those. Okay, so I've heard that medical practitioners will need to have a health check. Is this correct? So some of you might have heard, I was having a chat with Dr. Atkinson earlier. The medical board has put out a paper for consultation regarding health checks for all medical practitioners over a certain age. At this point in time, no decision has actually been made, but as soon as feedback comes to the college, we'll advise the members. So we think this is coming. We think this is coming, and we think that it'll be something like over 65 or over 70-year-old practitioners that will be required to have a health check. Okay, what's the next question? As a semi-retired fellow, do I complete an audit? So I know this is another area that's worried people a lot. And, you know, it doesn't have to be onerous. Again, I was talking to Kate the other day and I said, you know, what you could do, it's extremely important for our younger generation of surgeons that they get the amazing knowledge that our senior surgeons have. And if you went to a couple of meetings, so say, for example, you were assisting in a private hospital with a colleague, and they have an audit and M&M meeting a couple of times a year. If you went along to that meeting and you were involved in that department audit, that would tick your box for audit of your practice, because your patients that you were assisting with would be involved in that audit. So you don't have to do a private audit in your rooms. Some of you won't even have rooms anymore. You can be involved in an audit at a site. And I was saying to Kate that, you know, it's an absolute shame that a lot of the amazing experience and knowledge that you guys have gathered is being lost. And so I would really implore you to go back to some of your departments and pop in a couple of times a year as an honorary person to give some pearls of wisdom and be involved in those audits. And it really would not be very onerous to attend a couple of meetings. And there's certainly meetings online now that you could also be involved in that might help. So that's one way that you could do it. And what do I do for a performance review? So again, similarly, if you were working as an assistant, then you could get the surgeon that you're working with to do a performance review reflection, just a comfortable chat amongst the two of you to say how you were going as an assistant, and then could jot you a note on their letterhead, and then you could put that into the CPD to say, I've had my performance review from my colleague, and this is a letter to say that we had a chat and a talk about how I'm going as an assistant. That's something you could do. If you were doing medico-legals, then again you could talk to one of your colleagues that you perhaps attend meetings with. You could ask the insurance company that you work for to give you some feedback on how you're working. If you were doing some education roles or some health advocacy, you could ask somebody on one of the committees that you're on to give you some feedback and just jot you a note to say that you've done that and put that into your CPD. So it doesn't need to be a multi-source 3-day feedback. A lot of us still working in the public sector will obviously have a performance review from our managers, and we can use that. But if you're not in a public position, I do feel that you have many colleagues that would be only too happy to provide you with a short note to say that they know of your work and that you've had a chat about it and you've had some feedback. Next slide.
Right.
Lost our little.
Sorry, the question has come through. Could you?
That's all right. We're up to the we're through the things that I had to say. So now is the time for questions. Anyway, Kate.
There is a question that has come through. Could you just expand on performance of self and performance of others as part of the requirements?
Yes. So performance of self, if you're still in active practice, then you would consider doing audit in your rooms. So a lot of us do that. You know, we might do patient satisfaction surveys. We might audit a particular procedure that we did this year and then another one next year, have a look at our results, have a look at our complication rates. So, for example, at the moment I'm doing a patient feedback assessment, and it's a randomly chosen, patients are given a form and put that in, and I have a research assistant that just comes in a couple of hours a week and does a spreadsheet for me. So hopefully we'll see that that looks okay. That's a simple way of doing some in-rooms audit. But then if you have an X-ray meeting or a clinical meeting in your department, that's looking at your work as part of your department. So that actually covers you for audit of self. So, for example, we have a weekly X-ray meeting in our department where we go through all the patients of the week, and we reflect and feedback on each other's work. And so I'm getting feedback on my work all the time from my colleagues. So, and also I'm also feeding back to them on their work. So that is also auditing my work. And then, of course, in orthopedics, we're lucky enough to have the Australian Joint Registry, and that certainly can be used for your audit as well. Anyone involved in the CASMs or the ASMs can use those for their audit. So there's lots of different ways that you can do audit, and some of them are bigger than others, but depends a little bit on the type of practice that you have. Does that answer the question?
It does. Thank you. Does anyone else have any questions? Oh, hang on.
Can they put their hand up if they want to speak?
Yeah, just unmuting.
There is a little hand there if you see it on the screen.
Yep, there we go.
Can you hear me now?
Yes, we can, Lee.
Who assesses? I mean, when people are writing this down, it's pretty subjective. Who decides if they meet the sort of standard or not?
Well, that's a very good question. So it's a bit of an honour system, you know, you're going to put that in. What we do is that fellows are audited, and it's a random audit. That is a requirement of the medical board as well, that the colleges audit, and the new requirement is 10% of fellows are audited yearly. And so that means that 10% of all fellows CPD will be checked to make sure that everything they put in is appropriate, and that is done, so 10% per year. It used to be 5%, I think, and so basically it's an honour system that you put your forms in, and you know, we're trusting you as professionals to do that.
So what do you think will be the number, what percentage do you think will fail in that audit? What would you expect, or what's happened in the past?
I'll have to ask Kate to help us there, because I'm not sure about the past.
Oh.
So previously we've audited 7%.
Oh, sorry, 7%.
Yeah, our members. We go through and work with all our fellows to make sure that they submit the correct documentation. If it hasn't been submitted, we go back to them. We explain to them why it's not the right document, and we keep working with them until we can get the correct paperwork.
I see.
So, Kate, out of that 7% that you've been auditing every year, how many of them do you think would have a major problem?
Oh, maybe 1%.
1%.
Have you got any information on that?
About 1%, she said, that wouldn't have the appropriate paperwork.
Yeah.
So a very small number, I think.
Yeah.
It is a very small number, and as I said, we do work very closely with all our fellows and everyone on the CPD program, because we don't want people to fail. We want to make sure that they've got the correct information, so we will work with them until they achieve that.
Yeah.
And I mean, I think, honestly, Lee, if you were doing a learning plan, say it's about medico-legal, and you wanted a little bit of advice, it would be no problem to email, you know, the department and ask, is this appropriate? You know, my reflection and my, you know, my little learning plan here, and we're going to write up some templates to assist you as well. I did actually forget to tell you that. So I'm just going to look on my notes here, but we were going to provide you with some templates to help you with your requirements. So we could easily do that.
Well, you know, I find this very confusing at present, this new system. Now,
yeah.
we might get settled down and start following it, but, you know, when I compare it with the College of Anaesthetists, which is a bit old-fashioned, but then so was it's a little bit hard to follow, and
yeah.
So, but anyway, we'll need a lot of and see when you talk about communication, because of COVID and people working from home, it's very hard to when you ring to ask something, you know, they're either not there or they're at home or it's the wrong person. or the person at the front desk doesn't even know who to put you through to. It's just not working very well at present, is it? It's got.
So, yes, so you will see on the new web page, there's a contact us. So on the top right-hand corner of that slide, you'll see a contact us. So the best thing to do, honestly, I would tell you, the best thing to do is to shoot an email off.
Yeah, you need. So is there going to be tutorials on this around the different states to tell us how to work it? Because, you know, if I'm confused, and I set this up in 1991, you know, I started going with Tom Reeves at that stage. I tell you, there's a lot of my friends that are confused by this.
Well, maybe when the if you, I mean, we could actually run a tutorial, and so have you done the module on the web page? There's a e-learning module on the college web page, which is very straightforward about how to do it. And I did that, and I think you get a point for doing that.
Yeah, it's like one of the.
Yeah, you actually get points for doing the learning how to do it.
I'll try. Anyway,
so if you could do that, and I would suggest that you have you got an IT savvy granddaughter or grandson?
Yeah, I suppose that I can try that. Yes.
That would be very useful. But seriously, if you go onto the college website and look at the CPD explanation, it's actually quite straightforward, and it takes you through how to do it. Because I can tell you, I was worried about it too, and when I finished it off, it was actually very easy. Clicking onto the learning plan. Once you go into the learning plan, you tick those boxes. And then it just gives you a couple of boxes that you write your little learning. You just write I'm going to do this course and I'm doing it for this reason. And then the next box is your reflection on doing it. And then bang, it was finished. And I got my tick off and my big green tick. And I'd completed my 2021 CPD. So it really isn't that difficult. I think just, you know, it feels overwhelming to start with.
Thank you. Thank you.
That's all right. But I think if you do that first, and if you've still got questions, we could easily do a tutorial online.
Definitely we can, and I will take that on board and work on that. Drew Dixon has a question for you, Kerin.
Yes. Hello, Drew. I think you're still muted. Can you unmute him, Kate?
Yeah, I have. He should seem to. He should be unmuted.
No.
No.
Still muted.
Sorry, technology. And let's. Sorry, technology. Drew, are you able to click on your microphone and see if it will unmute that way? It is not working for us. My apologies. Maybe can you type your question into the chat, please, while I keep trying to unmute this. Oh, sorry, I was on mute then. So Drew wants to know when the dashboard will be available. So I can answer that for you. The new dashboard will be available from Monday. So we'll be sending out some comms towards the end of the week, this week, to let you know that it will be available and what's coming with it. And if you need help, you can contact the CPD team. We'll actually have some extra staff on to help answer phone calls, troubleshoot anything that you're having problems with as well.
But Kate said that it was best just to send an email. Is that right?
Yes, it will be an email that we'll send out, just welcoming you to the new CPD year and the new platform.
Well, see, that's right. I don't think an email is going to be good enough because you know, it gets lost in translation. We need to talk to someone at some stage, and
No,
I think you'll
you
have
can
to
always
go around the
contact
States.
me.
Yeah, good.
So we will be there. We'll send out some communications from the states and territories as well. And yes, we will have extra staff to answer phone calls. You can always contact me, and we will help you as best as we can. If it's an IT issue, we'll get the IT team to look at it as a matter of urgency. And yes, we will be here at the end of the phone.
Yeah, right, good. Okay.
And Drew's written in there from July to December. So Drew, it's important for the next year. The CPD is going from July right through to the end of next year. So it's an 18-month CPD period because of the changeover to the different timeline from the past. So as long as you understand that.
No, I don't. Because listen, if the registration comes up in September, how do we, if it goes 18 months, how does that work for September next year?
Yeah, so at the moment we're waiting to hear back from the medical board. So the 18-month period shouldn't impact your registration when you're renewing next year, because we're talking to the medical board, and as soon as the medical board has told us how that's going to work, we'll let you know. So
so you don't know the answer, really, what you're saying. You don't know the answer. You don't know the answer? Is that right?
There will be no disruption to your registration.
It won't affect your registration. We just have to work out how the medical board just has to look at the way they're going to look at the CPD. They just need to review what's happening, but they understand that this is what's going forward.
Well, what's happening with other colleges?
I'm not sure, Kate.
What was that? Sorry.
Other colleges having the same issues?
Yes. Yes, everyone is in the same boat at the moment. So
no, Kate, they're not, because the College of Anaesthetists has a straightforward program that's just the same every year. They haven't changed it, have they?
They will be making changes to their program in line with the new standards that have been set by the medical board.
Well,
you see, the medical board standards don't come in until January 2023, but we're instituting them early to get everybody around it, right? But I think we're a little bit ahead of the game compared to some of the other colleges of changing. But the reason we've changed is because they're medical board requirements.
Good. All right, that's a good explanation.
Okay.
Yeah, we will communicate to everyone if any changes need to happen as soon as we're aware of anything that comes through.
Good. Okay.
Any other questions?
What about with medico-legal reports? You know, in the past, we would put in 3 medico-legal reports, and that would be sort of relevant. Is that relevant anymore, or has that gone out? You'd get a peer review, you know, someone else will review your medico-legal reports.
So you can still use that same process for review of self. So So as the performance review of self, you can do exactly that.
Thank you.
That's all right. That's perfect. Okay. Is yours hand still up, Dr. Dixon, or have you got a new question?
I don't think he's there, is he?
Oh no, he's talking in the chat because we can't hear him. He said no, he didn't have another question. Okay. I can't see any other questions in the chat there. Well, I hope that's helped. We'll take it on board that you'd like to have a tutorial. I think that's actually a good idea, and we'll see what we can do. And we might do that once the app's up, and then we can do a tutorial on the CPD Online and the app.
Kate, I'd just like to follow that up. See, with this COVID going on, everybody's confused and anxious and stressed out of their brain, you know, and we can't travel, and we're not getting to the national meetings as easily, and you know, different meetings have been cancelled. The neurosurgical meeting's been cancelled next week or the week after, and and the college meeting was, God knows if that'll go ahead next year in Brisbane. I mean, I think if you can think about whether there's a place for someone to talk at the hubs and with people coming into the college places in Sydney, Brisbane, Melbourne, different places, and hearing what's the different discussions and sort of trying to sort this out, because I think there's a level of confusion just working out what it means and how it gets sorted out. So anyway, that's something you might think about.
Yeah.
Okay. Thank you. We'll take a note.
Feedback.
It is good feedback, so we will take that on board and work towards something for you.
Thank you. Thank you.
Okay. Okay. Well, if there's no more questions and everyone's vaguely happy, I know it's a bit daunting, but I'm absolutely confident that you'll find some very straightforward things that you can do. I'll just another example. I did the cultural competence online learning at the college. It's quite easy to do. You can do it over several weeks, and it gives you lots of points. So that ticks off your cultural competence. So there's easy things to do on the college website that will get you lots of points in your CPD and keep you registration ready.
Right, I'll do the cultural competence and see.
Yeah, do that. It's quite good, and it's got some lovely pictures.
Oh, that's good. Oh, that's what I need.
Yeah, exactly. Feel good stuff.
Well, thank you for your time. Thank you so much.
That's okay. Thank you very much. All the very best.
For your time. Bye-bye.
Bye-bye.
Are you right, Kate?
Yes, I'm good. Thank you.
Okay. All right. Well, thank you. I'm going to peel off because we've got PSAT very soon.
I know. I was aware of that. So thank you.
All right.
Well.
Good job. Thank you.
All right. See you later. Bye-bye.
Bye.